Oh, yay! We are live. Hello, humans. Welcome to our interview series we are doing for the session for the Total Worker Health Symposium for 2025, which is going down later this month. We think mainly virtually, but we will see. Today, we have Dr. Lisa Biala, or Dr. B. She is currently a health and safety an environmental lead at Mondelez International. In her present role, she leads the Occupational Health Clinic, where she focuses on industrial hygiene, ergonomics, radiation safety, and health and wellness programs. Ooh, impressive. Her 20 plus years of work experience expand across public health, occupational health, environmental management, safety training and teaching. Dr. B recently completed her Doctor of Public Health program. Woohoo! With Capella University. How's that? As a fellow PhD, I know how much work goes into that. Oh no, we're frozen.
Yes, ma'am. A lot.
Yeah, it's a lot of work. Congratulations on being done, because
Thank you.
I know how that goes.
Yeah.
I took 10 years to do my PhD. I took 7 years off, and then they're like, you can't take 10 years. You need to finish now. And then that's how I discovered I had ADHD. So it all worked out. Okay. Her research topic focused on improving ergonomic practices of the professional staff in the manufacturing industry. Oh, how cool.
Yeah.
Awesome. Okay. At the Total Worker Health Symposium, her title is going to be Improving Organizational Health and Safety at Mondelez International North America. So before we went live, I was going to ask her questions of what is Mondelez International North America? Let's start there.
Okay, so Mondelez International. Hi everyone. First of all, Mondelez International. It's we make cookies and we make Ritz crackers. It's a global. Ritz crackers, Oreo cookies, premium crackers, wheat thins, and it's a global company actually. So we have about 4 plants in the USA, several of them in Canada and in Mexico as well. But we have some in Europe, in Asia as well. So it's a huge global company.
Oh, that's amazing.
Yeah.
So you're in charge of a lot of humans, getting them healthy and safe, and doing that's a really big role. Okay, so let's start with how, because I'm super passionate about this too. Okay. How does eating affect the worker?
So when we think of eating, we think of what nutrients it's good for your body. And so when we come to work now, we want to be healthy and we want to make sure that our bodies can function properly in the workplace and do the job and stand and be able to stretch. So food actually nourishes our body, but eating the right type of food is what is critical for the worker. Sometimes we know workers spend a long time at the site, both for 8 hours, some 10, 12, and we know most of them spend a lot of time here. So we wanted to teach them like the healthy effects of eating, and I'm sure they know, but how can we use the workplace to encourage them to eat healthier?
Yeah, that's important, especially because so much of your day is spent at work. Mm-hmm. And if you're not consciously thinking about it, how we feel our body is going to give us the energy to be a better workforce and to be a better worker and to have more energy and productivity and all that. So how would you say, what is the best way to start that conversation with workers or to incorporate that at work?
So what we did first, we tried to do a survey and we wanted to understand what their needs were. And so after we took a sample of the population, and so after we took that survey, about, I think it was 63 or 70% of them said that, hey, we are interested in a healthy eating option. And so that is where we went from that one. Yes. And we also worked with David Shapiro. He is with the School of Colorado, and we looked at some of the objectives that we would need to help us to get these activities incorporated in our facility.
That's awesome. That's important. So, how would you say the health of the worker actually affects their work?
So we all know that if you have a healthy worker, we have increased productivity. We have increased morals. Job satisfaction. We have increased employee satisfaction, and so that all plays into productivity. So when they are happy, the employer is happy, and they come to work. They do their jobs. They do healthy. We reduce absenteeism, and so all of that plays into the healthy worker and productivity. And yes.
Yeah. So, on a lot of these interviews, what I've been hearing has come up a lot is basically the individuality of each worker.
Mm-hmm.
So, why would you say it's important to understand your workforce dynamics, whether it's like age, demographics, length of time they've been working? Can you go into that a little bit?
Yeah, so it is important to understand who you're serving. So for us here at the plant, we know that 70% of our population is male. And we know of that 70%, 60% is over 50. They're over 50. And so we have to understand the demographic, what affects them most. And so, like an African American population, different for that group would, affect the another population, a Hispanic population or Asian population differently. So understanding what affects your population, your worker population, is super important, and that plays into what your healthy eating option would be. So we know, for example, African Americans, they are more prone to hypertension and diabetes. So how are you going to tailor your healthy eating program to that? You cut salt, you cut sugar, snacking. Yes.
Yeah, I think that's important. And I think when employees feel like they're an individual and their needs are being met as the type of human that they are, I think from a sustainability and lifestyle perspective, it's way easier for them to feel, first, that you actually care about them, but second, that you're like, this will work for me and my lifestyle regardless. It's not just one size fits all, because we know like that doesn't work. That's kind of like checking a box, and it's just checking a box. It's not changing lives.
Yes, and if we can, and so we did not want to do that at all. We did not want to say, so even when we provided the healthy snack, so we have a healthy snack, we have a registered nurse. She delved more into nutrition aspect. And so when we decided to do that, we asked them what would they like and what do you want to see come back. And so we tailor the program based on them. And so that is how the program is, continued. It is, I think for now, is sustainable because we are listening to what they're saying and they are giving us their feedback. And I think that is what is driving the program.
Cool. That's awesome. Can I ask you some questions about the other programs that you have in the organization? I'm really interested because you did your doctorate on this, and it's part of, I have a program called Move at Work Challenge. That's 5 to 7 minutes of movement that people do at work. That was what I was going to be presenting on. We've been doing it for 8 years in a school district here in Colorado. But how do you incorporate ergonomics and posture and doing good work with a good body positioning in your role currently?
Okay, so the thesis that you were talking about that I did was geared toward professional staff. And I looked at it from 2 different angles. I looked at it from the professional staff in itself, and so the professional staff coming to work and sitting down for long periods of time. And I also looked at it from professional staff as designers of work. So if they understand how ergonomics, how bad posture, how
No.
fitting the job to the employees can affect the worker, if they understand that, then they can better tailor the jobs that they design, that they create to their employees. So it was like killing two birds with one stone. So yes, so I am the professional staff. I know that I need to get up and stretch. I need to get proper lifting and bending techniques, even though I'm professional staff and I'm not, on the floor. But I also understand that I am designing work for my employees, and so yes, I also need to take them into consideration and implement more engineering controls and elimination of ergonomic stressors for my employees.
Yeah, that's awesome. So you've worked across public health,
Hmm.
occupational health, and safety for more than 20 years.
Hmm.
What made you get into this field?
Um, So when I first came to, I was a teacher back in my country, and so when I first came to the U.S., I wanted to, I thought about doing other things, and health and safety was definitely one of, my priorities, and so getting into it, I decided to do some degrees in it, so my master's in occupational health, my bachelor's and master's degrees in occupational health. And so I wanted to make a difference in the workforce and communities of, underserved communities. So, yeah,
It's important work.
yeah,
I love that. But
thank you.
since you work at such a large, complex organization, and if you have 4 manufacturing plants here in the States, I'm sure it's ginormous. I'm sure it's such a challenge to work with health and safety at that scale.
Hmm.
How do you actually do it?
So actually, we have a team here, and yes, it's complex. Health and safety within any manufacturing organization, you don't even have to tailor it to Mondelez, but within any organization is really complex. And so understanding the different aspects of safety helps a lot. We also have a team. So we have our environmental specialists, environmental and sustainability specialists. We have 2 other health and safety leads as well, because it's so I manage the occupational clinic, but I also work in different areas. And then we have another lead that does machine guarding and engineering controls. And then, yes, so there's another lead that does is a project manager for specific lines. So it's within any manufacturing company, it's really complex, and knowing and understanding the regulations, working with the core team, working with your engineers, working with the operation leaders, is definitely a plus. And you have to do it. Yes. So I may have my ideas, but I don't know until I go out on the line and I talk to my employees and I talk to my operations and then I talk to my engineers and try to find that definitely common goal of what is best for the worker and the productivity of the plant, the profit. Yes.
Yeah, that's awesome. I love that, because often this happens in a lot of organizations, but you think you know what they need, so you create it, and then
Hmm.
they're like, we don't need that. Like, our backs hurt.
Yes.
And you're trying to. So I think
Yes.
it's great that there's open lines of communication
In,
that.
in fact, in all of our risk assessments, we have to include a core team member in the risk assessment. So we include the core team, we include the leader of the line or the department, and of course, safety is there as well. But yes,
Yeah, that's important. That feedback and communication is key for
yeah.
success. Cool. What role does employee engagement play in sustaining a strong health and safety culture?
So we definitely have to keep engaged, like I just mentioned about performing assessments and risk assessments. So we definitely would want to keep all the employees engaged in everything we do, especially when it comes from health and safety. Again, they know what is best for them. And yes, we have to incorporate other groups as well. But we definitely want to engagement and to improve engagement, and also it builds culture, right? Sometimes companies, not just at Mondelez, but you can look at within Mondelez, we try to understand how can we build culture, and culture is built around ensuring that we have 100% engagement in our workforce, especially when it comes to health and safety, because everybody wants to leave the same way that they came, to work.
Yeah. Or better.
Or better, yes.
That's the hard part, but yes.
Yeah.
If you were to give other organizations a piece of advice of where would you start if they're really looking into like their health and safety and well-being and how to strengthen that, what would your piece of advice be?
So I would say get to know your demographic, your makeup of your team. I mean, we say team, your core team, your salaried staff, everybody. So once you get to know that makeup of your staff, definitely you would want to communicate with them, see their wants and their needs, and try to understand what do they want from leaders within. Because myself, I have a boss, so I communicate with my boss, and he communicates with me, and how can he serve me, and so that is truly the definite part of servant leadership. How can you serve your employees? What needs do they want? How can you make them feel that they're safe when they come to work, and that they will go home the same way that they came to work, and to take care of their families? And I think that is what all of us want eventually, all the time.
I love that. Well, and that aspect of safety has been coming up in all of these interviews, of whether it's physical safety, psychological safety, and what safety means for one person is going to mean something totally different. And then I also heard you say opening up that line of communication of servant leadership, but also I think what needs to happen is shifting away from this, like, I'm the boss and I tell you what you need, versus we're all humans, and it needs to be a safe space where we can talk about what we need to be supported, what we need for our well-being. And I think for those folks listening, there's a theme that's coming up in all these interviews of it's not, we are adapting and we're changing. And I think to bring everybody up, it is that open line of communication and understanding that like every human is different, but that it starts with leadership and leading by example and having that feedback and communication open. So I love that every single person I've interviewed as part of the series brings that up. So if you're listening and you're part of an organization that has leaders, which is all organizations, it works best if you ask your humans what they need.
What they need.
Yeah.
And they will tell you.
Yeah. And the more you ask, then you don't even have to ask as much, because now you've created that open line of communication.
Yes.
Oh, thank goodness. We're all on the same page, and I love it. That's why we've all been selected as speakers.
I know, yeah.
Okay, so do you want to tell us your title again of your symposium presentation?
So my title is Improving Health and Safety at Mondelez International, and it's geared towards eating, healthier eating, and how does eating affect the employees' health.
I love that. And I think you can still register for a virtual ticket. And my session will be going down on Thursday, the 23rd at 11:15, potentially in room F1. And it's called Move at Work Challenge, Driving Employee Happiness and Health. Well, Dr. B, it was such a pleasure to have you. Is there any final words you want to leave for the people listening?
Well, all of us, like you said, we are humans, and all of us have a job. All of us want to make sure that we can relate to other humans, and other humans can relate to us as well, and make sure that safety is your top priority, and your employees would actually love you for that. You
Yeah.
have long, faithful, hardworking, sustainable employees.
Yeah. And safety goes far beyond what we think of the definition of safety. Like you're talking about eating and supporting and
Yes.
communication and ergonomics. Like it's so
Yeah.
much. It's not just like, yes, they have to come back the same way that they went to work, but it's
Yeah.
such a broad, as
Yes.
humans, we're not just one line, there's so much of us that needs to be considered.
Yeah.
Well, thank you so much for your time. That was amazing. If you guys have any questions or comments, you can leave them below in the comment box, and myself or Dr. B will answer all your questions. Okay, we hope to see you in Bethesda or online.
Yes. Thank you so much, Dr. Sarah.
Bye-bye.
Bye.
End.